Welcome everyone to the Safeguarding and Child Protection Policy Update briefing session. The updates are because there have been a number of changes in relation to safeguarding and child protection over the past few months, and this is an opportunity to update key policies that have influenced this are changes to working together to safeguard children, keeping children safe in education, inspecting safeguarding in early years schools and school settings, upcoming updates to the EYFS, and the upcoming domestic abuse bill that's going through Parliament at the moment. In addition, there are some procedural updates that are due to changes in local guidance from the Keeping Bristol Safe Partnership. That is where all this is coming from. Just a little note, the Keeping Bristol Safe Partnership has replaced Bristol Safeguarding Children's Board. Okay. So to start off with, we're going to look at the safeguarding policy. So Michelle, can we move to the safeguarding policy? So safeguarding children is a really important topic, and we have there is really only one change to this particular policy. So Michelle, could you scroll down? Oh, there we go. I've got a little block where this is. It's a change to the definition on safeguarding, and it is an expansion of one of those definitions. So where it used to say preventing impairment of children's health and development, that definition has been expanded to say children's mental and physical health and development. So that is the change that has happened. And that is to reflect, there were concerns before pre-COVID about considerations around children's mental health, but this has definitely, COVID has definitely raised the issue of children's mental health up the agenda, so that it is really important that is now part of your consideration in terms of safeguarding. Those changes have been in relation to both working together to safeguard children and keeping safe in education. Can we scroll down to the bottom of the policy there, please, Michelle? Lovely. And the other change we've popped in there are the changes to the upcoming changes to safeguarding welfare requirements, the 2021 changes that will be being put in place from September. Okay, thank you. So can we move to the main child protection policy, please? Okay. So here we are. And a while back, we changed the format of the policy. So it may be that if you've used the band sample in the past, you may not have adapted a new format. We updated it because to try and help people use the policy, make it more user-friendly. So now we have on the front page, we have a basically keeping track of when you made changes page, which we would advise you do at least annually. In practice, we find that the child protection policy needs changing every few months, but hopefully this one will last for a bit more longer. Can we scroll down to the contents page? Here we are. Lovely. We put in place an index just to try and make it easier to use, because the policy has expanded over the years, and sometimes you need to find a particular topic. So we've put in place an index so you can hopefully find the area that you're looking for quickly. Move to the next page, Michelle. Okay. Every policy should have an aim, and overall the aim of child protection is to protect children young people from abuse. In the reorganising of the policy, we have moved the implementation and monitoring section of the policy up, and so to help settings, understand, what they need to do in relation to child protection responsibilities. So that here we have the list of responsibilities, which involve having child protection officer, designated safeguarding lead, your requirement to be trained and updated and trained. But what the update that has happened is that the inclusion of this section, all staff and volunteers are aware how to support children to understand and recognise risk. And this update comes really from inspecting safeguarding in early years, and it really relates mainly to online safety, but also, it's helpful for children generally. So be able to identify the risks that they may face. Okay. So, right, can we scroll down to the next section? We also popped in this designated safeguarding team. So it's just a reminder in the policy for all your staff and volunteers who has those responsibilities within your setting. Obviously the names of those people with particular responsibility, but also photos, because some people understand information better visually. So this can be a real help to some staff and volunteers. So we found that can be very, very useful. Moving down now to the definitions, you should all have definitions of abuse within your policies, and the 4 categories remain the same, and there has been no changes to those definitions over the last period. Then moving to safeguarding issues. Again, there are safeguarding issues that you need to consider when you're working with children and families. Historical abuse, there's no real change there. Domestic abuse, quite some time ago, we changed the definition in the sample policy to include not only violence, but controlling and coercive behaviour. So that has not been changed recently. We've always had that within our policy. And obviously the impact of living with domestic abuse has on children. I think there's an increasing awareness. Moving on to FGM, female genital mutilation. This has been highlighted in the early years foundation stage, the safeguarding and welfare requirements. It is definitely in the upcoming ones as well, so that's part of your responsibilities. Where the changes have come in relation to the policy here is from the Keeping Bristol Safe Partnership. They now have a risk assessment for you to use. But if you suspect that a girl is at risk of FGM, and that risk assessment really is to expand the approach that settings need to take. It requires a sensitive approach, but also the risk assessment helps you consider the family and their values as a whole, and not just a blanket approach. What happened in Bristol is that some Somali families were feeling unfairly targeted under the previous protocol, in that, every time they went on holiday, they were being asked to sign FGM protection orders. And so they felt unfairly racially profiled because their values and attitudes towards FGM hadn't been taken into consideration. So this risk assessment should help you approach FGM in a more nuanced and sensitive way. And of course, you can always ask for advice around that. So, should you need it. Okay, so we scroll down a bit, Michelle. Thank you. Preventiality. you all have responsibilities around prevent to ensure, to try and prevent children and young people getting be radicalised and drawn into terrorism. There is basically the local numbers and information remains the same of where to get advice and make referrals should you need support around prevent and radicalisation. But there is a national update. So if you look the counter-terrorism education, there's a national information available and advice where you could get support if you had a concern around extremism. Just a side note in that in Bristol, the referrals that have been made under Prevent have a split between right-wing, extreme right-wing ideology, extreme Islamist ideology, and then there's another area of where there's no identified single ideology, but there is extremism. So just to give you an idea of the sort of things that have been happening in Bristol in relation to Prevent. Can we move to non-mobile babies, please, Michelle? Right. Okay. Again, this is a change that has happened locally to the guidance and how you should proceed. Previously, all non-mobile babies who had an injury had to be seen by the community paediatrician. Now the guidance has changed that a setting where there is a non-mobile baby with a mark, there needs to be a discussion with the community paediatrician, and then they will make the decision on whether or not the child needs to be seen. Okay. Michelle, can we just show where that guidance is in Keeping Safe Partnership? Okay. So here is the guidance around non-mobile babies. We quite often have quite a lot of queries around non-mobile babies. It's quite hard to say. And a non-mobile baby is a baby who's not yet crawling. Okay. Michelle, can we scroll down to, I think it's page 6, where we can see where this advice has changed. All right, lovely. Okay, so here we are. So the advice is that there can be a professional discussion. Okay, and that is absolutely a change. And should you need to use this protocol, then it's worth looking at this advice because there is much more detail. As you can see, it is a 12-page document. So it's worth, if you are working with babies, then it's worth having a copy of this document available. It must be said that although the requirement for all non-mobile babies with marks to be seen has changed to the consultation, the community paediatrician may say that the child needs to come in, but even if they say they do not need to come in, there still needs to be a referral to first response under the non-mobile baby protocol, and that should be explained to the parents of the child, that referral must be made. But it is not the same as a full first response referral. So I think it is very, very useful if you're working with babies to, whenever families register with you as a childcare provider, that you explain that up front so that parents are aware of your obligations underneath to protect babies in this particular way. You can come out of there, please, Michelle. Also, if you do not work with non-mobile babies, you do not need this section within your policy. So you can remove that if that is something that your setting doesn't do. Okay, so scrolling down, missing child. there has been no changes to missing child, though of course it is really important to have, to consider what safeguarding issues might arise from a child being missing from your setting and what you might do. And again, this year through COVID, it's really important that settings stay in contact with children who are not in their settings for a range of reasons. The safeguarding list of concerns has been in the banned sample policy for a while, and they come from keeping children safe in education and from inspecting safeguarding in early years schools and skill settings. But just having a quick look at the list, I've highlighted, though it's not a change, I've highlighted peer-on-peer abuse. This is a hot topic. I'm sure you've heard on the news about recent reports of sexual harassment and abuse in schools. This has been highlighted by the Everyone's Invited initiative, where children and young people have been invited to anonymously write reports of their experiences of sexual abuse and sexual harassment within schools. It must be said that most of this is happening in senior schools, but some of the reports are for children as young as 9. So it is a serious issue, and I'm sure there's could be a lot more coming out of this initiative, and I'm sure there'll be lots more advice and guidance as it moves along. The NSPCC have instigated a helpline in relation to peer-on-peer abuse, and it's really important that you retain an open mind on what might be happening within your setting. Here, if you do have issues on sexual abuse and sexual harassment between peers, the Keeping Children Safe in Education guidance is really useful because they have quite detailed guidance in relation to this topic and will help you manage any cases that you may come across. And in addition, Keeping Bristol Safe Partnership has got guidance on harmful sexual behaviour, which I'll show you a link to later. And further down so leaving that aside, moving down the list of safeguarding topics, we have honour-based abuse. This is a change in terminology. Previously it was called honour-based violence. And again, this change is to reflect that violence is not the only harmful thing that can happen. It relates to, again, domestic abuse concerns around controlling and coercive behaviour. So it's a change in terminology, but it's also a change in how we might look at things. Can we move on down? Lovely. Well, we've put a couple of additions in here to reflect some of the things that have been happening in Bristol. ACEs, Adverse Childhood Experiences. It's an approach to consider childhood experiences that directly harm a child, or the combination of them that harm a child, and recognise the impact that they now have for both the short term and the long term for a child's welfare and well-being and into adulthood. Bristol has signed up to be an ACE-aware city, and there has been training around ACEs and the ACEs approach as a strategy. And I expect some of you did that pre-COVID, and hopefully there will be more training on that as restrictions continue to lift. In Bristol, Health is taking the lead on the ACEs initiative. So it may be that if you're looking for training on ACEs, look around with the health leaders, you might find that training there. Secondly, I wanted to put in about contextual safeguarding. And this is really a way of looking at the harm that older children might be experiencing outside of the home. I think generally child protection processes have been better at responding to the harms that happen to younger children. And with older children, a different approach is needed to understand the influences that might be happening outside of the home, the influence that might lead to, significant harm. So the influence and what might be happening in environments in their community, in schools, online, and to give those influences on child or young person a different weighting depending on where that child or young person is being mostly influenced. So it is an approach considering that harm. In Bristol, the police are, through Operation Topaz, are using a contextual safeguarding approach to try and tackle child sexual exploitation. So they have a number of threads. They're looking at identifying possible vulnerable young people and trying to divert and prevent that those vulnerabilities being exploited, and then are also trying to disrupt the activities of possible perpetrators of child sexual abuse. So just to put that in context of what's happening in Bristol. So there are a huge amount of safeguarding topics out there. So what I think is useful at this point is just to show you where you could get more advice on safeguarding topics. So Michelle, can we link through to Keeping Bristol Safe Partnership page? Lovely. Okay, so if we then look, so here's the homepage for Keeping Bristol Safe Partnership. If you click on children, all right, and scroll down and say, I am a professional. Lovely. And then you will see here a whole list of topics and information about how and that will help you support, safeguard and protect children. So we scroll down, Michelle, to the threshold guidance. Let's have down a little bit further. Here we go. Lovely. We click on here. And so the threshold guidance is really information that the partnership provides to help you understand, sort of where you might have concerns about a child and what you can do about them. So if we click on the not to force threshold matrix, lovely to show people. So here we have a lovely matrix, and this is an idealized guide to help you understand perhaps where you might have concerns or you might not have concerns about a child, and therefore what you might do about that, and what sort of service you might think of approaching to get those child's needs met. So here we are, we're just not to force. There are matrices for all the age groups of children that you'll be working with. Okay, so green, let's look at the front one, top one here. Could you actually scroll that down a little bit for me? Because, lovely. So we're looking at different stages of thresholds. So if we look at, say, medical care, immunisations, so where it's green, that child is absolutely fine. Their immunisations are up to date. They've got they go to the health, they go to the doctor, they go to the dentist, everything's fine. Level 1+, which is a new category, is where a child might need a bit of additional support. But that additional support doesn't necessarily need to come from specialist services. It could come from you as a setting, or it could come from you as a setting signposting children and families to other services. So here where there are concerns where the engagement from parents is inconsistent. So to give you an idea of the sort of things that you might be worried about. And then where the concerns are getting a bit higher and things are getting a bit more complicated. So, that the child is things are becoming more complex. So that is where perhaps where an assessment of the child and the family will need to be made, and it's a way of accessing services through Families in Focus, early help services. So this is the situation. Actually, Michelle, I have difficulty seeing that. Could you scroll that up or down? I've got a problem with the block. Yeah. So that appointments are being frequently missed. Right? So that's where you probably be getting quite concerned, and you need extra help outside of your setting to help ensure that child has the best possible outcomes. Red is where a child is at risk of significant harm. So where the child is, missing, really essential health support, that medical care is being refused. So there could be a danger to the child's life. Yeah. So that would be sort of a direct first response phone referral to try and get access through social care to ensure that child's life is not put at risk. Okay, so these threshold documents are there to support you in understanding the levels of concern that you might have a child. As I say, they are idealised, but it's just to give you a general guide, and I think it's a really useful tool to have available to you. So we come back out of there, Michelle, and if we then, lovely, and then if we move to the Southwest Child Protection Procedures. Okay, right. The Southwest Child Protection Procedures, again, is a place where there is a wealth of information and guidance freely available to you. Okay, so these, as you can see on this front page, you can see procedures from local authorities across the Southwest area. So this could be really useful to you if you work across local authority boundaries. So say, for instance, your setting's in Bristol, but you have children who live in South Gloucestershire, and you need to look up what their child protection arrangements are. You can just look them up quite quickly using this website and this tool. But if we're going to pop and have a quick look in at the Bristol ones, so click on there. Lovely. Okay, so here we are. We've got how to report concerns, but I'm going to have a quick look at, let's have a quick look in contents here. Okay, so then core procedures, everything you need to know about referrals and child protection conferences and plans is in the first section. But in the second section, there's a huge amount of information on safeguarding topic guidance. So practically everything that you need to know around a safeguarding topic, there'll be information and guidance on this website. And I find it really useful because it is in alphabetical order in a range of topics. And there's more information on this website than there is on the Keeping Bristol Safe Partnership website in regard to safeguarding topics. So, you have information on children of parents with learning difficulties. You have information on dangerous dogs and safeguarding children. Again, this is a great resource for you as practitioners when you've got a situation where you think, I don't know enough about this particular topic. So you can look it up here. Okay. Right, to come out of there and go back to the policy. I think it's also really useful to say that we couldn't possibly put information on all those topics within a policy and it be readily usable. So again, having that information available online is really, really useful. Right, so we go to the next section, confidentiality. You'll be happy to know there have been no changes to the confidentiality section. And just a quick reminder, there's nothing in GDPR which will prevent you sharing a concern about a child where you believe the child is going to be harmed. So just a quick reminder on that one. Transfer of child protection file. Again, there have been no substantive changes to that topic. There's been a little tweak, formatting update on the Keeping Bristol Safe guidance, but not enough to change the guidance that we have within this policy. Moving on to protecting children, it's really, really important that you have a section on how to recognise abuse within your policy. So, because that is one of the requirements of EYFS. So staff and volunteers need to be able to recognise possible abuse. And those signs are possible signs. Of course, there are more signs as well. But what we have done is we scroll down, we have now added in a vulnerability section. This has come about through changes to working together to safeguard children and keeping safe in education. It's for you to consider what vulnerabilities children you're working with might have, and then what you might be doing to support those children. Obviously, the list of vulnerabilities is not exhaustive, and that vulnerability is something that can change over time with each child. In early year setting, every child does have a named key worker, and where a child is vulnerable and needs extra support, we would expect that key worker to be working together with either the designated safeguarding lead or with the inclusion lead to ensure that the child's need is supported. In oversized settings, where you have a child who you recognise as vulnerable, we would suggest that child has a named key worker and that you put together a plan to support that particular child. And if needed, that plan should be written, and so you can more readily review what progress you're making to support that child's needs. Okay, scroll down a bit, and then we come into what to do if a child abuse is disclosed. This is a direct disclosure from the child, and this is the advice and guidance that we have had in place for quite some time. So there are no changes to that section. And again, with what to do if abuse is suspected, there have been no changes to that particular section. So where we have made changes, there has been a little tweak. Is to what to do if it's an emergency, and this we've added in if a criminal act has taken place. If you believe a criminal act has taken place, the police should be contacted. This has come about from keeping children safe in education, where it was found that some schools were not reporting possible criminal acts to the police, and I think whether there are two possibilities to this is whether they were uncertain about whether it was a criminal act or whether they were acting in interests of protecting the school's reputation. We're not unsure, but it has been absolutely fronted up now that, and if you believe a criminal act has taken place, that should be reported to the police. Otherwise, the what to do in emergency section remains the same. You scroll down. You all should have a section on working with children and young people and how to recognise inappropriate behaviour in staff or volunteers. I'll have a little stop at the Lado. This is not an update, but where staff allegations have been made, it is most important that the ladder must be involved before you begin any investigation to a staff allegation. And this is something that does happen frequently, that where there is an allegation that a staff member has harmed a child, that settings quite instinctively start investigating before talking to the ladder, and they really must talk first to the ladder so that this procedure is fully legal and you don't fall into any pitfalls. So it's really important. That's why we put it in red. Scrolling further down, looking further down, the definition of a staff allegation has been expanded. The three previous definitions have stayed in place: behaved in a way that's harmed a child, possibly committed a criminal offence against a child, or behaved towards a child that might indicate they pose a risk of harm. The new part of the definition is behaved or may have behaved in a way that indicates they may not be suitable to work with children. So what is important to note here, that it's not necessarily behaviour towards a child. This may be behaviour towards an adult that might indicate they're not suitable to be working with children. So that could be in violent or abusive conduct. So this does relate to domestic abuse, and it's really important. It's an important change, and it does reflect the changes that are happening with the domestic abuse bill as well. So if an adult, either staff member or volunteer, was alleged to be a domestic abuser, you would have to use the staff allegation procedure to investigate what is going on in that particular situation. And, it is an allegation, and it's really important that it needs to be investigated sensitively and thoroughly, the way that you would investigate any other staff allegation. Thank you. So, Michelle, can we move down? And so the rest of the staff allegation procedure remains the same. Moving on to supporting staff and volunteers. So the addition to this section, again, relates to changes around domestic abuse. So the domestic abuse bill is going through Parliament at the moment, and it, as far as I'm aware, it is just about to be ratified. We don't yet have a date for it to become law. So the domestic abuse bill will be putting additional responsibilities on employers to support staff and volunteers who might be experiencing domestic abuse, to support them. Okay, so we've put in the addition that staff and volunteers may also experience abuse outside work, and they can talk to the settings DSL or line manager to seek support. So that really relates directly to this upcoming responsibility around domestic abuse. Okay. Moving on to recruitment and employment of staff and volunteers, a very important section, but there have been no updates on that particular section. So the use of mobile phones, cameras, and online safety. This has been highlighted in the upcoming changes to the EYFS 2021, and there is increasing the emphasis on settings responsibility in relation to online safety. We recommend that you have a separate policy for that, because it's too much to put into the child protection policy in detail. But in short, really, you're trying to protect both children and safeguarding practitioners. Okay, and the work, as I mentioned up at the top of the policy, a lot of the work in relation to safeguarding children in relation to online safety will be helping them to understand some risks that they might be facing online and how they might react and be able to manage those risks. So there's a real education role there, in addition to your responsibilities around filtering and monitoring devices and the internet that you use within your setting. Staff behaviour, that section has not changed. You all should have either a staff behaviour or code of conduct policy to make it clear how you expect your staff to behave and work within your setting, make things clear. And again, with whistleblowing, there have been no changes here. Okay, but it's important that you have a whistleblowing procedure so staff can address concerns. Okay, scrolling down to further information section. There have been lots of updates here to the many guidances that we need to look at. Okay, so the multi-agency guidance is for non-mobile babies that we previously highlighted is listed here. Working together to safeguard children. Please note, it does say the date 2018, but be aware that it is being tweaked almost continually. The last update I noticed to it was dated December 2020. So although it says 2018 on it, there are little tweaks, and that's where the children's mental health got emphasised. Okay. Should we scroll further down? Okay, as I say, there was a minor tweak to the transfer of education files, child protection files to education. So that's a little tweak, but it's very, very minor. And then we've listed both of the safeguarding and welfare requirements, the EYFS, one that is currently in position and the one that's due to start in September. Also put a link to inspecting safeguarding there. That really probably be most used to managers. The inspecting safeguarding really is a document for Ofsted inspectors, but I think that some managers find it very useful to help them assess where they are in relation to their safeguarding responsibilities. Keeping children safe in education, 2020. Early years providers do not need to follow keeping children safe in education fully, but it is a useful document to have reference to. And as I've mentioned before, some of the changes have come about in this policy due to the relevant bits of keeping children safe in education. But there are also bits in there that you might find useful as practitioners. Keeping Bristol Safe Partnership Protocol, children who display harmful sexual behaviour. That's a useful tool, local tool, that also has links to local services that might help you in relation with if you've got children whose sexual behaviour is cause for concern. And as I just mentioned about online safety, there is some government information around online safety considerations here. And there are a couple of documents there, one that relates to managerial responsibilities and one that relates to practitioners' responsibilities are both useful links and will be of use to you. And I think that can help you expand what your practice. And when you read them, if you've tackled the Bristol Safeguarding audit recently, you will see that the issues that are raised in the safeguarding audit are really raised in those documents. Okay, we scroll down. Lovely. We've kept the appendix, though that information is available in other formats. Again, whatever format of the policy you use, it's really useful to have your local information about your setting, who's responsible for what, the information about first response, the families and focus numbers, both for advice and guidance. Make sure you highlight the number that you need, and that all the staff know which number it is. Are you north, central, east, or south? Otherwise, most of those links have not, contacts have not changed. Scroll down a little bit further, Michelle. What has changed in support and advice? There's a new email address for the Keeping Bristol Safe Partnership training. I know that quite a few of you are waiting for interagency training as designated safeguarding leads and deputy designated safeguarding leads. If you haven't already, I advise you, if you're looking for that training, please do email them and let them know of your needs. Otherwise, they don't know what the demand is going to be, and they are trying to recruit a new training officer in a minute. So hopefully that they will come on board soon. And also to reflect the changes in relation to domestic abuse, we've now added a few domestic abuse information helplines. So Nationally Refuge, next link, Bristol relevant, but also there is the Employers Initiative on Domestic Abuse, and that will they have information that will help you sort of meet your responsibilities in relation to domestic abuse as an employer. Okay, it must be said that we are actually working on a draft domestic abuse policy at the moment, and we hope to get that information to you sooner rather than later. Okay, can we scroll down, please? Okay, and here we have the poster that seems to be quite popular across Bristol, and it's just again some really quick links to services that you might need in a hurry. Okay, so I think many of you use this as display in your settings, but also use it as part of your induction staff, which is really important. Okay, so please do ask your development support worker for a copy of the updated policies and procedures. And we are going to stop recording now